Join us now for Health for Life, brought to you by Vitruvian Health, formerly Hamilton Healthcare System. Today we're talking with Dr. Stephen Paynter of Hamilton Physician Group General Surgery in Dalton. Thank you for joining us, Dr. Paynter.
I'm glad to be here.
Dr. Paynter is a board-certified general surgeon at Hamilton Physician Group General Surgery. He attended medical school at the Medical College of Georgia. He completed his general surgery residency and internship at East Tennessee State University School of Medicine. Hamilton Physician Group General Surgery is located at 1504 Broderick Drive in Dalton. He and his fellow surgeons provide the latest medical advances in general surgery and personalized care. All right, Dr. Paynter, today we're going to talk about two of the most common procedures that general surgeons perform, and that is gallbladder surgery and hernia repair.
Yes, that's correct. They are both some of the more common surgeries that we do at Hamilton Physician Group General Surgery. As a group, we do about 400 to 500 laparoscopic or gallbladder surgeries per year, and probably another 300 to 400 hernia surgeries.
Wow, so let's talk about the gallbladder first. What exactly is the gallbladder and what does it do?
Yeah, very common question. The gallbladder sits up under the rib cage on the right side. It's attached to the undersurface of the liver. It basically is a storage pouch for bile. Bile is necessary to digest fatty foods. It's made in the liver, drains from a tube from the liver into the intestine. And on the side of that tube is the gallbladder. So when you're not eating, typically the gallbladder will gradually fill with bile. And then when you eat a meal, particularly a greasy or fatty meal, the gallbladder is going to squeeze and empty.
So why do they sometimes need to be removed?
Well, the most common reason is that stones form in the gallbladder. We really don't know why that happens. There certainly is a family tendency, and it's a little more common in women than men. But stones form when the gallbladder quits working like it should. We really don't have a way of making the gallbladder function properly again, so typically that just is going to require surgery to remove the gallbladder and the stones. The stones are floating around, and sometimes they've been there for years or months, and without warning, when you eat a meal, the gallbladder squeezes, the stone gets stuck where the gallbladder is trying to squeeze, and it pushes against the stone and brings on very typical episodes of pain. That pain can be usually under the right upper abdomen, but it can hurt into the right chest. It can hurt into the mid-chest and kind of mimic a heart attack. Nausea is also a very common symptom.
So is this something that can kind of be detected or prevented before it really gets bad?
Sometimes we find them accidentally on some other type of x-ray, but usually it comes to our attention after a person has an episode of pain or nausea. They'll either mention it to their family doctor or come to the emergency room if it gets really bad, and then an ultrasound or other type of imaging will show us the gallstones.
So it's usually kind of a surprise when it happens.
Usually is the first episode, Although sometimes people have a bad one, and looking back, they'll find that they had some more minor episodes that they just passed off as indigestion or they ate something funny. But a lot of times it's been there for a while, causing some minor symptoms.
Yeah, so once it gets to that point, how would a gallbladder surgery be performed?
So the surgery is usually done laparoscopically. This is usually an outpatient surgery. It does require general anesthesia. In other words, the person goes completely asleep, so they're not aware of anything, can't feel any pain. And most of the time we can do this with 3 or 4 small punctures. Sometimes those are finger size, sometimes even smaller, like the size of a pencil. And we usually have to remove the entire gallbladder and the stones. If we leave the gallbladder and just remove the stones, the gallbladder still doesn't work, and usually the stones will reform. It's a very common operation, very low risk, not totally risk-free, but one of the safer and more common operations we do. Again, that's outpatient, so most people go home the same day and return to fairly normal activity and work within a few days or a week or two.
Well, that's good. So usually it's intense pain that has a very low-risk operation?
Yes. So sometimes more mild pain, sometimes very intense pain. But a very common and relatively low-risk operation, yes.
Wow. So are there any long-term effects of having the gallbladder removed?
Not usually. Occasionally, people will get diarrhea after gallbladder surgery. Most of the time, the body adjusts to that naturally, and we don't treat it. But sometimes it can last and persist, and for that reason, we have medication we can treat it. But usually, people can return to normal diet and normal activity and lead a normal life without the gallbladder.
What are some of the other reasons that somebody might have to need to get that removed?
The usual reason is that the gallbladder just doesn't empty well, but doesn't form stones. Usually that will also present with pain or nausea. Sometimes people are actually even a little sicker because it happens all the time. They'll even smell food and feel nauseated or have pain. And there's a separate test that would detect that. It's called a hepatobiliary scan, which again the doctors would order, and it shows us how well the gallbladder empties. So an ultrasound tells us how the gallbladder looks to see if there's stones present, but the hepatobiliary scan tells us if the gallbladder is working or not. So typically the gallbladder will empty at least 35 to 40% or more with a fatty meal. And the test mimics what happens after eating a fatty meal. And so if the gallbladder only empties less than 35% and you have symptoms that really sound like gallbladder, then we will usually offer gallbladder surgery to remove it. And most of the time, people get dramatically well after the operation.
So could people get rid of their gallstones without any kind of surgery?
That's not something that's usually a good idea. You don't want to pass a gallstone like you might a kidney stone. If you have a stone that gets out of the gallbladder and into the bile duct, it can cause actually more serious complications. It can block the bile duct, leading to liver infection, liver failure, can cause pancreatitis, and both of those can be quite severe and even life-threatening. There are sometimes some internet searches that you can do about creative ways. People talk about trying to get your gallbladder past gallstones, but really we don't recommend that. The gallbladder still doesn't work. New stones will form, and you do actually risk having more serious complications trying to pass gallstones on your own.
So it's absolutely the best choice to get it looked at by a professional.
Yes, you can temporarily, get on a low-fat diet. So there are people who, for a variety of reasons, we have to postpone the surgery, and we recommend a low-fat diet, and that sometimes will help minimize the risks. We see this in pregnant women. A lot of women will have gallstone problems that develop or at least become aware of during pregnancy. And sometimes we prefer not to operate while they're pregnant. And so we can usually temporarily get them by doing a low-fat diet and wait till they deliver and then do the surgery.
Yeah, so kind of moving on to our second topic of hernias. What is a hernia and why do hernias need to be repaired?
So what we're really talking about for this radio interview are abdominal or groin hernias. There are a lot of different kinds of hernias in different parts of the body, but a groin or abdominal hernia is typically when you develop a weak spot or essentially a hole in the lining of the abdomen. That can be very common in the groin, but it can also occur in incisions at the belly button, and there's several other potential weak spots in the abdominal wall. When the hernia gets large enough that a loop of bowel or intra-abdominal contents can push through it, then that becomes a little more serious. It can block your bowels and become more of an emergency. So when you have a hernia of the abdomen or particularly the groin, we usually recommend repair of those.
Do they always tend to need to be surgically repaired?
For the most part, yes. There are some exceptions. Small belly button hernias that are just plugged with fat a lot of times will never cause trouble, so those can sometimes be safely watched. Umbilical hernias in infants are actually likely to close by age 5, so we usually recommend not repairing those unless they get older and they still persist. But most other groin hernias are going to continue to get larger and more symptomatic, and so most of those we recommend repair kind of at a planned or elective time.
So how is that performance, like that surgery, actually performed?
There's a variety of ways to repair hernias. Some of those can be repaired with the laparoscope or even the robot. Many of those, we still do a traditional incision and repair them that way. Particularly groin hernias, there's several options about how to repair those. They're usually outpatient, again, about a 30 to 45-minute surgery. Groin hernias can be repaired under local anesthesia with sedation. And so patients that are high risk or want to avoid general anesthesia, that's an option for them. Typically, the surgeon will sit down and, talk to the patient, go over the options, see what might work best for them. Sometimes we have recommendations based on the type of hernia and the size. And we do usually use mesh for the repairs. The mesh makes the hernia repair much stronger. And so this is one of the areas that we still continue to recommend and usually use mesh for hernia repairs.
What kind of like pain levels do you see patients have when they're dealing with a hernia?
So before surgery, they can sometimes have no pain and just not even be aware of it. Sometimes there's just a lump or swelling, but sometimes it can cause discomfort. Hernias in the groin are much more common in men and even little boys, but they can occur in women as well. And again, sometimes they just show up with a swelling, sometimes with pain that gradually gets worse with activity. And usually we can detect those on a physical examination.
So could hernias possibly become an emergency?
Occasionally they do, and that's one of the reasons we recommend elective or non-emergent repair. But sometimes the bowel can get trapped, and if it gets trapped in the hernia, within a few hours you can get swelling. Swelling kind of feeds on itself and causes circulation to be cut off, which causes more swelling. And sometimes, again, within a few hours, you can actually lose circulation to a section of the bowel that's trapped in the hernia. So this is one of the operations that we sometimes do as an emergency. It's also one of the reasons that surgeons prefer to do those as a planned surgery and not an emergency, because it's much safer and easier on the patient to have it done non-emergently.
Wow. Well, Dr. Paynter, thank you for coming on the show.
Yeah, it's been my pleasure. Thank you so much.
For more information or an appointment at Hamilton Physician Group General Surgery, call 706-278-6403.
This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem.
Thank you for listening to Health for Life, a presentation of Vitruvian Health, formerly Hamilton Healthcare System.